Okay, so I consider myself the biggest technophobe ever. If you would have told me last year that I'll be doing a television show from just outside my house in my cottage, I would have said no way. But COVID-19 has forced me to embrace technology, and here I am speaking to you. But one of the other things that I'm about to try out is to have a virtual consultation with my doctor. I'm doing that in a couple of days. I've never done it before. How is it all going to work? But it's a pleasure to have the CEO of Discovery Health, Dr. Ryan Noach, who's joining us now. Hi there, Ryan. How are you?
Hi, Reddy. When you said you're about to have a virtual consultation with your doctor, I thought you were going to start asking me clinical questions again.
No, not this time. Okay, you've got to persuade me to embrace this. You know, our relationships with our doctors, they're so personal. We want to see them. How are we going to get the same medical care when there's a gadget between us? How's this going to work?
Yeah, look, I think we're all getting used to a completely different way of living, working, and that should also include accessing healthcare. And why this is so incredibly relevant is because it's much safer in the first instance. I mean, imagine if you're a doctor with 30 sick patients coming to see you every day, and each of those could potentially have COVID-19. So it's much safer for doctors, and I would argue much safer for patients also who don't have to sit in a consulting room. You need not be scared of it. It's actually very easy.
So how is this different? Because Discovery had Doctor Consult, if I'm not mistaken. There has been some, technology and interacting with doctors using technology in the past. How do you distinguish this from what you've been doing before?
So actually, this is using Dr. Connect, which is Discovery's digital health platform. It's quite a sophisticated platform for Discovery Health members that we've been offering since 2017. And I think what's different now is that we've quickly rebuilt Dr. Connect to make it available to all South Africans together with Vodacom, so that jointly between Vodacom and Discovery, we're able to offer this technology of virtual consultations to any South African who believes that they may have COVID-19.
Often the kind of thing that makes my life easy, your life easy, because we've got access to technology, to data, Wi-Fi, can inadvertently create new inequalities in that your poorer users won't have access to that kind of platform. So just elaborate for me, how are you making this available so that every Discovery customer at whatever level of income or health plan, every South African eventually can access this very crucial service, especially at this time?
Yeah, look, you do require an internet connection, which is actually all you require to make access of the service. Once you've got an internet connection, it's available through Vodacom's website or through Discovery's website to any South African that can access internet. And so this high access really does lend itself to broad public use.
Well, Ryan, I can tell you this. My significant other is very excited about this. He's a medical doctor and also quite anxious about COVID-19. As his wife, I'm also quite relieved that he doesn't have to get into his car and go to the practice. This is something that we definitely are going to be embracing and rolling out. And coincidentally, I have to go consult a doctor in a couple of days, and we are talking about doing it virtually. Stay in touch with us because I do want to let you know how it went.
I'd love to hear an anecdote of your experience, just reflecting on your comment about you're going to record it. Wow, that's brave.
I'll record it. I'll show you how I'm doing, how comfortable I am with the consultation. Nothing to hide here. Telemedicine, very exciting disruption and innovation. May it serve all citizens who need it. Discovery and Vodacom in this partnership. Thanks, Ryan.
Very cool. Good luck.